Cedar Rapids #1 for New Country, 98.1 KHAK. Good morning, it's Brady and Courtlin. We're very happy to be joined on the phone this morning by Dr. Dustin Arnold, Chief Medical Officer with Unitypoint Health in Cedar Rapids. Good morning, sir. Thanks for joining us.
Good morning.
And we've been trying to get a medical expert on our show because I don't know if you know this or not, but DJs don't know a lot about coronavirus.
No, we don't.
Really? I usually go to the DJs for my medical advice. So
well, we read a lot of articles on social media.
Do you?
So
Oh, well then.
that's all of our
I told the
research.
medical staff, I said, if you were using Twitter for clinical decision support prior to the pandemic, we need to talk. And if you're using it now, you need to stop.
Oh, my gosh.
Yes, absolutely.
Well, Dr. Arnold, the coronavirus pandemic has a lot of people around here very concerned, obviously, with the closures and things like that. I think it really drives home that the threat is real. Can you talk about the threat that faces Eastern Iowa right now?
Well, it's twofold. And as I've said, it's not a numbers game. It's a timing issue. So, people say, well, this is just like influenza. It's just like the flu. Well, it's not, and I'll come back to that. But, 60,000 people get the flu each year, or 60,000 deaths and a couple million. What if all those people showed up within the same week?
Yeah.
That's what we're trying to prevent. We're trying to prevent that, flatten the curve, prevent that surge of patients that would, quite frankly, overwhelm the healthcare system in the United States. And so if we can space it out a little bit, and that's why we have the rather extreme measures that we're taking. When people ask me, they go, well, can I go to that party? Can I go to that restaurant prior to them closing, of course? I say, how many grandparents have to die before you're going to stay at home?
Yeah.
And, it's just that simple. That's what we need to do. The other concern is even with swine flu, which was H1N1, I believe. No, that was avian flu. But we all have a little carryover immunity each year.
Okay.
Because we all have some antibodies to the H and some antibodies to the N that's in these influenza strains, and we have a vaccination. We have medications for it, Tamiflu and the vaccine. We don't have that for this. We don't have a medication to treat this. Remdesivir, which is an Ebola drug, which is not effective for Ebola, has been shown some promise. Otherwise, it's just supportive care. So. And if nobody has immunity to it, it would just plow through a population like they saw in Italy and also in China. It's interesting in China, if you look at the map as part of the number of people that died, that Wuhan, the province that's in, it was like a 16 to 17% mortality rate. Outside of that province, it was about 1%. So that just tells you that they just got overwhelmed all at once.
Yeah. We're talking with Dr. Dustin Arnold, Chief Medical Officer with Unitypoint Health here in Cedar Rapids. We were talking, of course, about coronavirus. Doctor, what are the symptoms that people out there need to be very aware of?
It appears now. This is dynamic because we're learning all the time about it as it comes through. But it appears that it starts off with a kind of fatigue and muscle aches and just generalized malaise, not feeling well, and that's about a 3-day time period. And then that's when the fever and the cough start, about day 3 or 4, we believe. Only about 60 to 70% of people have a fever at the time they present. They all have a cough and shortness of breath. That's pretty predominant. But fever by itself, the absence of fever doesn't mean you don't have coronavirus.
Talk a little bit about the danger of people who are asymptomatic, that they don't show any symptoms and can still be carrying it.
Absolutely. There's something in the medical literature called a super spreader, and these are people that, for whatever reason, they generate more pathogens and contagions than other people. And at first, it was believed that you didn't have asymptomatic spread. Then, as China started to go back and look at cases, they started to report that in Italy. Obviously, seen that, and we know it's here. Mm-hmm. So that's the worrisome thing. Now, that happens with other diseases. You asymptomatically can spread it, sure, but not to the degree with this one. As far as there's no immunity, there's no flu, there's no vaccine, there's no medications.
And what's going on with the whole testing situation? Do we have enough tests to start testing everybody here in Eastern Iowa, or are we just doing just people of a certain age?
Well, we are we're using evidence-based medicine when we make that decision. We're just not testing people. just for the sake of testing. So if people have a presentation or a high risk, they traveled international or been on a cruise, we are testing them and send it to the state hygienic lab. At St. Luke's, we are in the process of our reference lab is Mayo Clinics, and I would guess by the end of the week we'll be able to start sending tests up there if needed to the reference lab. And I think they're actually using Quest, which is another company, as kind of a contracted to do that. But coming back to the testing, I really think that's kind of overblown or not accurate in the fact that we're treating these patients symptomatic. We're telling everyone to isolate. We're telling everybody to wash your hands. The 3 C's: cover your mouth when you sneeze or cough. Clean, wash surfaces frequently, and wash your hands. And contain. If you have symptoms, stay home. Don't come to work. And so the testing from a medical standpoint, it really doesn't matter. I mean, we have community spread. It's here. If a patient shows up and they have symptoms consistent with that, that's what I'm going to treat for. I'm going to make sure I didn't miss something else that I can treat.
Yeah. And
then I'm going to move forward. So, this concept of the testing is not available really is not that big a concern in the medical field. It would be nice to be able to say, oh yeah, here we have this number of cases, and here's the case. This is the case curve, and this is the demographics of it. That would be nice, but it's not essential. And we do not know what the false negative rate is. That's when the test is run and the person has a condition, but the test is negative. I've seen from 70%, so that means 30% of the time the person would have COVID infection, but yet would have a negative test. So the testing, it's not hampering our ability to deliver care.
We're talking with Dr. Dustin Arnold, Chief Medical Officer with Unitypoint Health in Cedar Rapids, about the spread of the coronavirus. That being said, you were talking about the fact that you're testing certain people, but not everyone. Are you convinced that even though we haven't had any confirmed cases in Lynn County, you're fairly confident that it is here?
No, I'm not, and I'm going to tell you why.
Okay.
Based on Chinese data and Italian data, this is pretty virulent in the fact that it makes people sick, and it has an incidence of about 70%, and about 15% of people that get sick have to be hospitalized. And neither hospital in town has had a case of someone with an illness we couldn't identify and explain, and end up in our intensive care unit. So on one hand, I'm thinking, well, if it is that virulent, between us and Mercy, and Dr. Myers, Tony Myers, who's the CMO over there, he's a friend and a colleague, and we talk a couple times each day and share best practices. They haven't had it, we haven't had it. So part of me says maybe it's not in the community yet. And we see that each year with the flu. Mm-hmm. You'll see that you'll have 1 or 2 cases, and then there'll be kind of a pause for 2 weeks, and then they'll start to come in again. So there's some variability to it. So I'm not absolutely convinced of that, but I do think acting and performing each day in what we do as if it is a community spread is reasonable.
And what do you say to all the people out there who think this is all just a hoax and that everybody is overreacting?
Well, like I said, I tell them, one, the United States has X number of motor vehicle accidents each year. What if they all showed up on the same day? What if all the accidents in the United States, motor vehicle accidents, happened on the same day? What would that do to our healthcare system, in our fire rescue, in our emergency services? It would overwhelm it, and that's what we're trying to prevent. I also say, hey, like I said, how many grandparents have to die before you're going to stay at home?
Yeah,
it's just that simple.
Mm-hmm.
Well, Dr. Dustin Arnold, Chief Medical Officer at Unitypoint Health, thank you so much for joining us today and answering some of our questions. I know a lot of our listeners have reached out and wanted some of these things addressed, and I think just getting the right information out is just so crucial at this point in time. So thank you for helping us do that this morning.
Yeah, my pleasure.